Assalamu alaikum. I'm Professor Dr. Hayder Jawad Mubarak. I will present the first lecture in the curriculum of systemic embryology. This lecture will be about the development of the musculoskeletal system. At the beginning, we have to revise some of the descriptions to the trilaminar germ disc in early stages of development, as this figure showing. The trilaminar germ disc is formed of three layers, which are the ectoderm dorsally, the endoderm ventrally, and in between is the mesoderm. This configuration occurs during the third week of development, but later on, in the late third week of development, the mesoderm will show some features that will lead to organogenesis. Here, the mesoderm will be configured into three parts. The mesoderm on the side of the midline, which is this one, will become compacted. You know, the mesoderm initially is a loose tissue, but later on in the third week, the mesoderm on the sides of the midline will be compacted to form a mass-like structure which is called somites. And more lateral to this compacted mesoderm on the side of the midline, which will form the somite, more laterally to the somite, the mesoderm will be called as the intermediate mesoderm. And if you will go further laterally, you will find that the lateral parts of the mesoderm is dividing into two layers separated by a cavity. These two layers are referred to as layers of the lateral plate of mesoderm. One of these layers is near to the ectoderm and is called somatic layer of lateral plate of mesoderm, and the other layer is near to the endoderm and is called visceral or splenic layer of lateral plate of mesoderm. Somatic or parietal lateral plate of mesoderm, splenic or visceral layer of lateral plate of mesoderm. And the cavity occurring between these two layers is called the intra-embryonic cavity or sulum. So, in summary, the mesoderm during the third week will be divided from medial to lateral into the following. More medially on the sides of the midline is the compacted somites. Then going laterally, there will be the intermediate mesoderm, and going more and more laterally, these are the parietal and visceral layer of lateral plate of mesoderm. We have to know here that the somites, because they are lying on the sides of the midline, they are derived from the piece of mesoderm which is called Paraxial mesoderm. And you can see that the midline shows the neural tube and the notochord. So we can say that the paraxial mesoderm or the somites are lying on the sides of the midline, or we can say that the paraxial mesoderm or the somites lies on the sides of the neural tube and notochord. It is the same. And one other point The compaction of the mesoderm, of the paraxial mesoderm to form the blocks of somite, occur in steps, and the initial stage of compression of the paraxial mesoderm will not be called as somite, because the cells are compacted but they are not so close to each other, and so they are called initially as somitomere. But further compaction, when the cells become adjacent to each other with no intercellular space in between them, such a final degree of compaction will be called as somites. Before completing such a compaction, it will be called somitomere. This figure, although it is a chick embryo actually, but it simulates that of a human, shows the gross features of the somites, which are tissue blocks on the side of the midline, and here in the midline you can see the neural tube, and these are the somites start to be developed on the sides of the neural tube. So the somites will be formed as blocks of compacted paraxial mesoderm. These somites will extend from the back of the neck, which is called the occiput region, because the bones on the back of the neck, the bones of the skull on the back of the neck, is the occipital bone. So we can call this region on the back of the neck the occiput. Initially, the somites will begin near the occiput, near the back of the neck, and then they will be formed further and further caudally. After being initially formed, the somites are initially formed on the back of the neck in the occiput region, but later on they will extend more and more into the thoracic region, and then the lumbar region, and so on. This figure also shows the blocks of the somites on the side of the midline as they are seen from the outside in a whole mount embryo. Again, this is a mice embryo, but it simulates that of a human, which is seen in scanning electron microscope. This is a figure, of course, of a human. You can see that the text here saying that the pair, you know why we are using the term pair, because the somites are on the right and left side. So the pairs of somites occur first in the cervical region, as we said before a while, into the occiput, at day 20 of development. But after day 20, after the first somite has been developed, more somites or more pair of somites are adding anterior to the first somite and then caudal to the first somite. And the addition of more pairs of somite will be in a rhythm of 3 somites in each day. So at early stage we will have the first somites in the occiput, in the neck, and then there will be 3 pairs. The first somite will be on day 20, of course, and on day 21 we will add 3 pairs of somites anterior to the first, and the next day we will add 3 somites per posterior to the first, and then going back to the anterior till we are completing the more anterior somites, and then the addition will be in form of 3 pairs more caudally to the trunk region, thorax, abdomen, and so on. Finally, we will have 42 to 44 pair of somite, and such a total number will be developed at the end of the 5th week. So development of the pairs of somite will begin on day 20, which is the late 3rd week, and it will continue during the 3rd week and 4th week until the end of the 5th week. But what is surprisingly is that number, the total number. We are saying 42 to 44. Why? Because the number of somite will be as following. We will have 4 occipital somites, 4 pairs of occipital somites, and then more caudally we will have 8 pairs of cervical somites, and then 12 pair of thoracic somites, 5 lumbar pair of somites, and 5 pairs of sacral somites. Finally, we will have 8 to 10 pairs of somites in the coccygeal region, and that's why if you will have 8 pairs in the coccygeal region, you will have 42 number of somites, and if you'll have 10 pairs, you will have total number of 44. After formation of the total number of somites, which is either 42 or 44, the first pair of occipital somites and the last 5 to 7 coccygeal somites will disappear, while the remaining pairs will form the vertebral column, which is the axial skeleton of the body. Each somite during the 4th week will start to differentiate more and more, and in that week, during the 4th week, the somites will have, each of the somites has 2 parts. Including the following. First, I just want you to see in the figure that we are producing a central region in the somite, which is this one. Sometimes the central region appears as a cavity, and it is called the cavity of the somite, or called somatocele. I have to say that because the 2 parts that will soon be described for the somite will be in relation to this central cavity, the somatocele cavity. So what are these 2 parts of the somites that are developed during the 4th week? This figure will help us much in description of the 2 parts of the somites. You can see the central cavity, the somatocele cavity of this somite and that somite. The 2 parts are a ventromedial part. If you are going to this figure, this is a somite, and that is also a somite. So these are somites of a pair, and you can see that these somites lies on the sides of the midline, and the midline shows the neural tube and the notochord. So this is the ventral and medial part, the pink part or the brown part of the somite, the ventral medial, which is part, the first part described here. This part is called skeletal. As you know, earlier stage of this part is compacted tissue, but when the ventromedial part of the somite form the sclerotome by differentiation. The sclerotome will go back into a loose tissue. So the compacted tissue here will be again forming a loose tissue. And the loose tissue of the sclerotome, the ventromedial part, will migrate medially to surround the neural tube and the notochord. And this loose tissue of the sclerotome, the ventromedial part, when they will migrate medially to surround the notochord and the neural tube, they will differentiate here. The loose tissue of the sclerotome will differentiate as they are surrounding the neural tube and notochord, forming fibroblast cells, chondroblast cells, and osteoblast cells, because these sclerotomes, when they will differentiate here, forming fibroblast, chondroblast, and osteoblast, the resulting cells, these three types of differentiating cells, will start to form the vertebral column around the notochord and the neural tube. So this is the first part of the somite, which is differentiating from the somites, from the ventromedial part of the somite, which is called the sclerotome. The second part, in addition to the sclerotome, is the dorsolateral part. As you can see, this is the ventromedial part, the sclerotome. So this is the dorsolateral part. It is formed of what is called dermatome and myotome. And so it could be described in one term, which is called dermomyotome. The dermatome part will form the dermis of the skin, and it have a nerve supply from the adjacent segment of the neural tube forming the spinal cord. If you remember in introduction of anatomy, the term dermatome refers to a region of the skin supplied by a single spinal nerve. So that is the embryological fact behind the terminology of the dermatome. Each dermatome of each somite receives spinal nerve from the adjacent part of the spinal cord, which is derived from the neural tube. And that's why this part, because it is supplied from one spinal nerve, so in anatomy, the dermis derived from this dermatome in a region of skin is supplied by a single spinal nerve. So this is the first part of the dermomyotome, that is the dermatome. The second part, which is the myotome, it will form muscles, the skeletal muscles. And actually what will happen later on, that the myotomes will spread, and when these myotomal cells will spread, they will reach the limbs, and thus forming muscles of the upper limb and lower limb, and they will reach the trunk, and thus forming muscles of the trunk, muscles of the body wall. Another subject that needs to be revised here, I think the subject of the paraxial mesoderm, intermediate mesoderm, and lateral plate of mesoderm had been described with the general embryology in the first semester. And again, I think the subject of the neural crest which is also shown here, had been described in the first semester, but I will revise it. What is the neural crest? Neural crest cells, as shown in this figure, are cells lying on the lateral folding of the neural plates. You know, the mid region of the ectoderm will be thickened during the 3rd week of development and so on. And this thickened midline region of the ectoderm will be called as a neural plate because it is thickened in the midline. And then after, this thickened neural plate will be folded and thus forming the neural fold. And what is between the folds is the neural groove. And later on, this groove will be closed to form neural tube. That circle refers to the configuration of the notochord. So the definition of the neural crest is related to the neural folds, because the neural crest cells are defined as cells derived from the ectoderm, and they are developing on the lateral borders of the neural folds. Another definition could be described for the neural crest is that the neural crest cells are cells of the ectoderm that lies in the junction of the neural plate and the other surface ectoderm, because here is the region that is the junction between the neural plate, which is folded here, forming the neural groove, and the surface ectoderm. Or you can say that the neural crest cells here are lying at the lateral borders of the neural folds. These neural crest cells, the ectodermal cells, after being differentiated, they will spread down into the underlying mesodermal tissue or mesenchymal tissue. And so these neural crest cells, when they will be spread in a form of loose mesenchymal tissue, they will migrate to many regions in the body, and thus they will contribute to many structures in the body, including the following. The spreading mesenchymal neural crest cells will reach to the face and the head region, and they will form connective tissue and bones of the face and the skull. Also, the neural crest cells will form the neural cells, the neurons of the ganglia of cranial nerves. Also, the neural crest cells will reach the thyroid gland and produce C cells of the thyroid gland that are responsible for secretion of the calcitonin hormone, regulating the calcium. Moreover, the neural crest cells will reach the developing heart, and they will form part of the septum of the heart. Specifically, is the part between the conus cordis and the truncus arteriosus, which is called conotruncal septum. This septum will divide the aorta from the pulmonary trunk, and also dividing the infundibulum of the right ventricle from the vestibule of the aorta of the left ventricle. Moreover, the neural crest cells will form the odontoblast cells of the teeth, and they will form the dermis of the face and neck, and they will form neurons in the spinal ganglia, which is the dorsal root ganglia. The neural crest cells will form neurons of the autonomic ganglia, which are the ganglia of the sympathetic chain and the ganglia of the peripheral parasympathetic system. The neural crest cells will form the medulla of suprarenal gland, which is called also adrenal gland. Also, neural crest cells will form Schwann cells that surrounds the peripheral axons forming the myelin sheath. Again, the neural crest cells will form glial cells of the brain, astrocytes, oligodendrocytes, and so on. And also they will form melanocyte cells of the skin that will produce the color, brown color of the skin, which is melanin. Finally, the neural crest will form part of the meninges. More specifically, they will form the arachnoid matter and the pia mater of the meninges. They will not form the dura mater. Both the arachnoid and pia mater are fatty in structure, and therefore they could be described as leptomeninges. So, from this revision to the precursors of the musculoskeletal system, which I had just made in consideration to structures that are developing in the third week and after of development, and so I think that you know these structures from the last semester, from the first semester of general embryology. Now I will describe embryology of the muscular system specifically. The embryology of the muscular system must include embryology of smooth muscle, then embryology of skeletal muscles, then embryology of cardiac muscles. Starting with the smooth muscles, we have to say that all smooth muscles of the body are derived from the visceral layer or splenic layer of lateral plate of mesoderm, including the smooth muscles of the stomach and other parts of the GIT, of the gastrointestinal system, smooth muscles of the vascular wall, smooth muscles of the even respiratory system. Except, or an exception to this rule, which is the origin of smooth muscles from the visceral layer of lateral plate mesoderm. The exceptions are smooth muscles of the pupil of the eye, the smooth muscles of the mammary gland of the breast, and smooth muscles of the sweaty gland. These three organs, pupils of the eye and breast, sweaty glands, have smooth muscles that are derived from the ectoderm. And actually this is a surprising phenomenon that the ectoderm form muscle because these are an exception from what is normal. Cardiac muscles. Embryology of the cardiac muscle is similar to that of the smooth muscle. Also, cardiac muscles are derived from the visceral layer or splenic layer of lateral plate of mesoderm. Surprisingly, that the cardiac muscles are striated muscles, but their origin is from the same embryonic precursor, which is the visceral layer of lateral plate of mesoderm, or the splenic layer, and just like smooth muscles. Embryology of the skeletal muscle. is generally from the somites. And as you remember that the dorsolateral part of the somite is called dermomyotome. This dermomyotome is formed of dermatome and myotome, and we had just said that the myotome spread and migrate to many regions in the body, forming muscles in the limbs and muscles of the body wall and the trunk. However, the head region anterior to the somites, you know the somites are 42 or 44 pair of somites. So the paraxial mesoderm anterior to the most anterior somite will be also compacted, but the compaction will not be to that degree which will be able to call it as somite. So we will call it as somitomere, which is the initial stage of somite. So the paraxial mesoderm in the head region anterior to the first occipital somite, this somitomere here also will form muscles in the head region. So by that, the embryology of the muscular of the skeletal system is from first somite to somitomeres in the head region anterior to the first occipital somite. In addition, in the neck region of the embryo, you will see later on that the neck region shows on the sides tissue blocks on the sides of the neck or on the sides of the pharynx. These are the blocks here represented on the outer surface of the embryo, and these are the blocks seen in section. These blocks are called pharyngeal arches, which are blocks of mesoderm. And so we have to say that some of the muscles in the head and neck are also derived from the mesoderm of these blocks, mesoderm of the pharyngeal arches. So skeletal muscle, but that time are derived from number one, the somites. These are the tissue blocks of the somites. Two, they are derived from the somitomere in the head region, derived from the paraxial mesoderm just anterior to the first occipital somite. Third, the skeletal muscles, which are striated muscle of course, are derived from the pharyngeal arches on the sides of the neck or on the sides of the pharynx, and these skeletal muscles derived from the pharyngeal arches are muscles of the head and neck region. If we want to consider more details about the origin of the skeletal muscles, the striated skeletal muscles, we have to say that the myotomes of the dermomyotomes are localized in two regions of the dermomyotomes. So you can see a myotome in two regions at the dermomyotome. The dorsomedial region here, the dorsomedial region of the dermomyotome, will form muscles that are termed as epimeres. These muscles are formed during the 5th week of development. These muscles, as you can see, are near to the spinal cord and near to the midline of the back. So you can imagine that these muscles of the epimere from this myotome will form the erector spiny muscles on the back, on the sides of the vertebral column. The epimere muscles will form the erector spiny muscles on the side of the vertebral column. And these muscles are supplied segmentally from the adjacent spinal nerve originating from the neural tube. The other part of the dermomyotome that forms myotome is the ventrolateral region. That was the dorsal medial region forming the epimere. This is the dorsomedial, while this is the ventrolateral region of the dermomyotome. Here, this ventrolateral region of the dermomyotome will form muscles which are called hypomere, also in the 5th week of development. And that ventrolateral myotome of the hypomere are the muscles that will spread to form muscles of the limbs and muscles of the trunk. And because they will be spread to a distance, so that to reach the muscles of the limb and trunk, there will be a nerve supply derived from the spinal nerve of the original position, actually, which is the ventral ramus of the spinal nerve. Finally, we have to say some points in regard to development of the muscular system, specifically the striated muscles of the skeletal striated muscles. First point is that the striation occurs in the skeletal muscles during the 3rd month of development. And the second point is that the upper limb are derived, the muscles of the upper limb are derived from the dermomyotome near or opposite to the neural tube in the cervical, lower cervical region and upper thoracic region. And that's why we have to say that the muscles of the upper limb, for example, are derived from the dermatomes of the somites in the lower cervical region and upper thoracic region. And this origin of the muscles of the upper limb explains the root value of the brachial plexus supplying the muscles of the upper limb. You know, brachial plexus is formed by ventral rami of spinal nerve C5, 6, 7, 8, and T1. And that is because muscles of the upper limb are originating from the dermomyotome of the 5th C5 somite, C6 somite, 7 somite, C8 somite, and the 1st thoracic somite. So muscles of the upper limb have the same nerve supply of the adjacent parts of the neural tube, which is adjacent to the somites of origin via the brachial plexus. And similarly, the lower limb muscles, or muscles of the lower limb, are developing from the dermomyotome of the lower lumbar and upper sacral somites, and thus having nerves from adjacent spinal nerves, which are the lumbosacral plexus, via the lumbosacral plexus. And actually, the nerve supply is not only providing nerve impulses for the muscles, but the nerve supply also promotes the maturation of the muscles in the upper limb and lower limb and even into the trunk. So Up to this point, we had finished an introductory review to the precursors of the musculoskeletal system, and we had described the embryology of the muscular system specifically. And in the next lecture, I will describe the embryology of the skeletal system. After completing details of the muscular system, embryology of the muscular system, I will discuss later on in lecture 2 of embryology. I will discuss specifically embryology of the skeletal system. Thank you.